Emergency Department, Trauma Baytime, 1347. Personnel, Dr. Raya Kapoor, Trauma Lead, Dr. Lucas Meyer, Emergency Physician Nurse Olivia Chen, Charge Nurse Respiratory Therapist, RT, Jamal Reed Orderly, Ben Action Orderly, Ben. Wheels Scooby-Doo in on a trauma stretcher, left hind leg splinted, multiple abrasions. Dr. Kapoor, projecting. Airway patent, gag reflex intact. Place him on 10L-Min-O2 by face mask. Nurse Chen, BP 9254, HR 156, SpO2 91%. Dr. Meyer, 2 18-gauge IVs, bolus lactated ringers 500 ml. Draw CBC, CMP, type and screen, COAG. Dr. Kapoor, pain score 9, give fentanyl 2 UG, Kegri IV. Prep for full trauma imaging, CT head, chest, abdomen, MRI of pelvis and leg. Radiology, multi-slice CT suite time, 14:05 personnel. Dr. Dina Solanki, radiologist CT tech. Marco Action Tech. Marco administers iodinated contrast 80 milliliters via power injector. Dr. Solanki, dictating. CT head and torso negative for internal bleeding. Compound mid-shaft fracture of left femur with 3 cm displacement. No visceral injury. MRI suite time, 14:32 personnel MRI tech. Alicia Dr. Solanki action. Alicia runs T1, T2 STR sequences of pelvis, lower limb. Report, comminuted femoral fracture, partial tear of vastus lateralis, neurovascular bundle intact. Bedside, fast ultrasound time, 14:50 personnel. Dr. Meyer sonographer. Ped action fast negative for intraperitoneal fluid. Pleural spaces clear. Operating theater, orthopedic fixation. Time, 15:20 personnel. Dr. Amara Singh, orthopedic surgeon, lead. Dr. Kenji Ito, assist surgeon, anesthesiologist. Dr. Grace Holt, scrub. Nurse Carla, circulating nurse Yusuf procedure. Induction with propofol, fentanyl, rocuronium, ET tube secured. Antibiotic prophylaxis, cefazolin 2-Dre IV. Open reduction internal fixation, ORF. Lateral approach, fracture ends debrided. 12-hole titanium locking plate applied. 4 proximal and 4 distal cortical screws. Irrigation with 3L saline. Plus bacitracin, wound closed in layers. Estimated blood loss, 300 ml. 1 UPRBC transfused. Post-op dressings applied. Leg placed in hinged brace. Post-anesthetic care unit, PACU, time, 18:05 personnel recovery, Nurse Miguel Dr. Ito. Action vitals stable, BP 118-70, HR 104, SpO2 98% RA. PCA morphine initiated. Neurovascular checks Q15 min, cap refill, 2S, dorsalis pedis palpable. Intensive care unit time, 20-30 personnel. Dr. Kapoor, ICU, Nurse Fatima physiotherapist, Leo action, continuous cardiac telemetry, Foley output 45 ml/h. Begin passive range of motion right limb, left limb immobilized. Labs acceptable. HGB 11.2, G-JAW DL, lactate, 1.6, MENNMOL-L. Operating theater, wound inspection, time, 23-hour personnel. Dr. Singh, scrub nurse Carla. Action under IV ketamine sedation, sterile field reestablished, sutures dry, no hematoma, additional. Topical vancomycin powder applied, redressed. Orthopedic ward, room 12 day 2, 10-hour personnel. Ward nurse Hannah physiotherapist Leo action Scooby-Doo sits upright, assisted to dangling position. Incentive spirometry Q2H. Oral meds, celecoxib 100 mg bid, enoxaparin 40 mg SC daily. Weight-bearing status, toe touch with Walker planned POD 3. Discharge, lounge day 4, 0915 personnel. Entire care team action Scooby-Doo, tail wagging. Roo thank Roo doctors. Dr. Singh, smiling. 6-week follow-up, no full sprints until X-ray shows union. Scooby-Doo signs discharge papers with paw print, exits hallway on 3 legs, trots cheerfully out. Final medical summary diagnosis, open comminuted. Mid-shaft left femur fracture, soft tissue lacerations. Imaging, CT multi-slice, MRI limb, fast ultrasound. No visceral trauma procedure. ORIF with locking plate. Secondary wound inspection. Hospital course, hemodynamically stable, no infection, early physiotherapy initiated. Outcome, discharged home with hinged brace, anticoagulation, rehab plan. Case ID, SD Ortho 2025-04. Prognosis, excellent. With adherence to rehab. Before leaving, Scooby-Doo thanked the team of doctors and went away.